We're nearing Pride Weekend here in the Twin Cities, and today we wanted to take a moment to share a resource available to the LGBTQ community here in Minnesota. So we're here with Lydia Burr, the Director of Operations at the Hazelden Betty Ford Foundation. Thank you so much for being here.
Thanks for having me.
Yeah, it's really important that people know all resources available to them. So we know that the foundation addresses both mental health concerns and substance abuse issues. Why is the LGBTQ community more susceptible to those issues?
There's a number of reasons why the LGBTQ community is more susceptible to concerns around substance use and mental health, and the community is disproportionately impacted when compared to the general population. A lot of this is because of some of the social factors that are involved. There's an internalized shame and stigma associated with substance use disorder and mental health conditions, but then when we see the interplay between that and sometimes the societally imposed stigma around being a member of the community, it can really create a lot of internal and external barriers that prevent folks from getting the care that they need and being able to access the services that they need.
Absolutely, and everyone needs a safe space, so I'm glad you guys are doing the work that you do. So you guys look at mental health and substance abuse at the same time. Why do you guys do that?
An integrated and then also culturally responsive model of care is what leads to the best outcomes for any patient population, LGBTQ community included. So there's a very high rate of co-occurring substance use and mental health conditions at the same time, and which came first doesn't necessarily matter as much as addressing both concerns at the same time and doing a lot of education about the way that those two things intersect and how they feed off of each other and make each other worse.
Okay, thank you for explaining that. So what are the barriers that you see for people in the community, specifically here in Minnesota, around getting help?
Like we were talking about those societal factors and some of the social factors, there is the shame and the stigma around having the problem and reaching out for the problem, not being able to take care of it myself. And then for the LGBTQ community, there's also this question of where is it safe for me to seek help? Where will the staff and professionals understand my experience, and will they take my experience seriously as part of my care? And I think those are the types of things that can prevent people from reaching out. And then there can be barriers to access around payment, that sort of thing as well.
Okay, of course, we're hearing that the foundation is a safe space, but
Absolutely.
for families who are watching who may be in this situation, how can families help kind of break down some of the barriers that they're facing?
Yeah, I would really encourage family and loved ones to go to hazeldenbettyford.org for information and resources. We have resources specifically for family, chosen family, loved ones to be able to have the tools they need to speak from the heart to to their loved one, to the person that they're worried about. And resources for them to access so that they can gain manageability over their lives as well, which have become unmanageable because of somebody else's use potentially.
Absolutely. Thank you so much for highlighting the foundation, Lydia, and giving us another resource to have in our community. Absolutely. We'll definitely have more details on the Hazelden Betty Ford Foundation at care11.com/noon.